Hey, tell me something about it. Was it something that does mine, or?
Yeah.
Could be was better, or what?
Yeah.
Infectious disease. Some say that, there's others though. Like,
It can be caused by a number of different things, viruses, bacteria,
Good.
other things.
good job, yeah. What else?
Required every year.
Just because, right? Well, then you should be able to tell me about it. Sometimes like doing it for everyone.
All it really tells us what's the new flu vaccine.
Yeah, basically, that's it.
And don't touch it.
The vaccine doesn't work.
What else?
It can be pretty traumatic to you and your family if you end up with some of the crap that we told.
Yeah. So how many of you, to that point, how many of you are anxious to take, I don't know, meningitis home to your family? Anybody, you're good for that?
Oh, no, I think it's anxious. I don't want to.
To my in-laws.
Wait a minute, that's being recorded.
Hey, Ben.
Yeah, don't say my name.
So how many of you are anxious to bring home chickenpox to your little ones?
They gave it to me, so.
So to that point, kind of a big deal, right? The idea, so I'm not gonna give you medical literature of how not to, but definitely will give some pointers of how to. Not very home. So what else can I tell you about infectious disease? And by the way, just so we're clear, so what I'll give you for the next 2 hours is about infectious disease. Dr. Edmondson will be in here 3-ish to knock it down in terms of stuff. A lot coming your way this afternoon. What I've got for you, what he's got for you, what we got for you. What else about it?
Spread different ways.
Yeah, so how it's spread is a big deal. And so you and I can play a part in terms of stopping that spread along the way. Be it by hand washing, be it by coughing into our sleeves, be it by something else along the way. We can break that barrier along the way. Right? So a lot to talk about, so let's go. Here we go.
I can crack talking.
Oh, I see. We
I
talk
was paying
about,
attention when the guy was talking, so.
you're having an effect, not necessarily a positive effect. You're having an effect.
That's probably been him for a long time.
So we talk about infectious disease. We're talking about an illness caused by infestation of a body biological organisms, be it bacteria, virus, fungi, protozoas, or helminths. The two that we're going to talk about, probably the most, is bacteria and viruses. You hear the most about. But just understand there's someone other ones out there that create problems as well. So the good news is that you and I live with bacteria and viruses in our body every single day. How long does it take for you before you end up getting sick with an respiratory type thing? How long does it take for you to actually show up and be sick and medical on the way? On average. Incubation period is somewhere around 3 to 5 days. For somebody with the flu, somewhere around 3 to 5 days. So that being said, the idea that you've got these viruses walking around, developing over a period of time, it's going to take a while before it actually shows up. And we're going to talk about the stages of how that happens from start to finish. The good news is that, assuming that we're in a pretty good health state, the idea that most are not going to be life-threatening to us. Who is it going to be life-threatening to? What population?
Children.
The youngsters, us oldsters, who else? Immune suppressed, right? So the idea that certain populations that don't do so well with it. Paramedics often first to encounter. You and I are on the front line of this right here. That's why it's kind of a big deal. So who are these guys? Way back before Matt could even count as to how long it was going to be before he got out of here, we were talking about that. What is that?
The guys that study the diseases, the disease process, how it's spread, where it comes from.
So why does that matter here? And this one, why does it matter?
because we're the first ones that encounter that.
Yeah, we are, but why are they kind of a big deal in this whole process? They're the ones when you see on the news that there's so many cases of the flu in Spokane County. They're the ones that are actually putting that out with public health. So they're part of the public health agency. You know, by the way, he didn't tell you his thing, but part of what your Jared O'Connor last week was, probably somewhere along the way, he's done this. So that's the dude there keeping track of all the stuff that's going on. You need to go check that. There's characteristics of the host, infectious agent, the environment that at least clues as to how the agent was transmitted. So if it's an airborne, if it's by feces, if it's by urine, it's by whatever it might be, the idea as to how it's set up is part of what we're talking about. Excuse me. So as we start talking about hepatitis, for example, there's about 6 different types of hepatitis, and there's more that's being heard about every single day. So there's a difference between hepatitis B and hepatitis C as to how it's transmitted and moved along the way.
Why is it hepatitis rather than hepatosis? It's a disease rather than just a spiral.
That's for somebody else that's a whole lot smarter than me. So all this is talking about, folks, is going from local agency to state agency to CDC. And so the idea, as we talked about in the first module, we talked about the fact that public health can have a police state, if you will, depending on what's going on. And that's kind of all this is right here. OSHA is a part of this in terms of the overall scheme of things. Not that they play a huge part in terms of numbers, but the idea in terms of workplace issues. Majority of diseases are organisms that are microscopic. That is, you and I can't see it by the human eye. And again, normal flora, the beautiful thing about the way that we're created is human normal flora is part of keeping us disease free. So you probably should know that opportunistic pathogens are non-harmful bacteria that cause disease only under unusual circumstances. What does that mean? What does that mean?
In us or around us.
Yep, that's part of it. They're in us or around us, and
They're usually benign until underlying circumstances arouse them.
correct. Like what? Immunosuppressed would be surely one of them. Sickness would be another. But does that mean that all flora is going to create a sickness along our lines? Give me another couple examples about opportunistic factors. Have you ever been in a situation to where you're sitting in a paramedic class and you've been sitting here forever and ever and ever, and then you go out and you work and then you spend a lot of hours and you're in the community and everything else like that, and all of a sudden you start feeling run down? Have you done that at all during the past 4 months?
No.
So just theoretically, man, the idea in terms of you and I, the idea that we had our immune system ended up being run down along the way is an example of this right here. It doesn't have to be anything real dramatic, although when we're talking about immunosuppressed patients, it certainly is the best example of that. Make sense? You don't need to know this, but just kind of interesting. Bacteria, that they do something that's called a Graham stain. And so when you look under a microscope, the shape of it and then the color of it, depending on how it shapes out on the microscope, is part of what they call a Graham stain. That's the way they recognize whether now we're talking about a virus, or we're talking about bacteria, we're talking about fungi, we're talking about protozoa. That's the way they end up doing it. Something that's called a Graham stain. When you hear about E. coli, probably more with food and hepatitis. The idea in terms of that is a rod shape. There are spirals. There's cocci. When you hear about staph A and staph B, The idea with the shape, that's all they're talking about. So you need to know that. So the good news is this, the good news and bad news about this. Most bacteria will respond to antibiotics. You go to the doctor, they start you on an antibiotic, and 4 or 5 days later, 6 days later, you're starting to feel better. The antibiotics have kicked in, the antibiotics have taken care of the bacteria. Does that mean there's no bacteria left in your body then at that point? You better hope not. The idea that we need bacteria to help us keep us in homeostasis state. But to that, the idea in terms of antibiotics would do the job most of the time. When do they not do the job? Or when is there a problem?
There's resistance.
If you don't finish the whole.
Yeah, so if you don't finish the course, what do you mean?
It'll kill just the bacteria, the percentage of the, like the weaker bacteria will die, but then you have like the percentage of the more resistant bacteria.
And they can come back around again. Good. What do you mean in terms of resistance?
Antibiotic resistance.
What is that?
Bacteria that have been exposed and developed immunity to certain antibiotics like MRSA.
Okay. So why would antibiotics not kill all that?
Why wouldn't it kill it?
Yeah.
They've developed a mechanism to adapt and become immune to it.
Okay. So check this out, folks. We live in an environment where all of us, everybody in this room, has been exposed to MRSA. We've all been colonized. Okay? That's the bad news. Here's the good news. The good news is that because of us being healthy and everything else like that, the idea in terms of MRSA is something we've been exposed to, but not that we're going to take home to them or anything else like that. So to that, when the oldsters and the extended care facilities end up on antibiotics because of MRSA, we're not talking about penicillin, which is kind of a common type antibiotic. We're talking about some super type antibiotic that number one is expensive, and number two will kill everything in sight. So it's like kind of like nuking all the bacteria, if you will, in terms of the essence of that. So when it talks about most bacterial infections respond to antibiotics, that's a true statement. In terms of the general, what they call a broad antibiotic, no big deal, except when it doesn't, then they have to go to the nth degree and nuke everything that's inside. That's bad news for you and I. Bad news for our patients in terms of becoming more immune suppressed because of that. This is part of the problem. This is part of the life that we're living in now. So that's exactly this. Different antibiotics required to treat different bacteria. So when you go to the doctor and you've got some sort of bacterial infection, they look under a microscope and tell me what it is. One of the things they will do is they will test them with several different antibiotics to determine what works best for you. So if you're started on penicillin and it turns out that amoxicillin would be a better drug for you to go to, then they will kind of move you over to that. So that goes back to the exam statement I was talking about earlier. This is kind of what we've been talking about. That is that folks are starting antibiotics at a moment's notice, and it's not good for us for long. So viruses, much smaller than bacteria. You should be able to tell me, by the way, because I know you want to ask the question. You should tell me the difference between bacteria and viruses in terms of how it separately makes sense. So viruses, much smaller than bacteria, only seen with an electron microscope. Cannot reproduce and carry on metabolism all by themselves. So they need a host in terms of spread. Okay, so you and I can break that cycle, but the idea in terms of somebody that coughs in your face is a good example of how this can reproduce but get passed on instead. By the way, if you didn't know it already, viruses and antibiotics do not work well. Antibiotics will not kill viruses. Antibiotics will not kill viruses. So the idea, and one thing that's happened over a lifetime, is that antibiotics have been given out despite the fact that it's just a virus, will not make any difference. So going back to this right here, cannot reproduce and carry on themselves. Instead, what they end up doing is entering the host cell. So somebody comes along. Alex, I'm assuming you already washed your hands. So comes along and I shake hands with Alex because it's been a while since I've seen him and everything else like that. By the way, that I haven't washed my hand. That is an example of that right there. That it gets spread on in a number of different mechanisms. It can be by a cough, it can be by a handshake, it can be by touching something, it can be a number of different things. 400 types of viruses that are out there. We're not gonna hold out here in terms of fungi and parasites that we're kind of move. So we're talking about fungi. We're talking about a plant-like microorganisms. Where do you hear about fungi or fungi issues? Yeah, certainly in terms of like shrooms or something like that, right?
Yeast infections.
Yep.
Athlete's foot.
Yep. So in all those things, any kind of fungus among us, the idea in terms of that fungus is all about you need a moist, warm environment in terms of spread. That's why when we talk about athlete's foot, it's in the crevices of the toes. It's in the anytime that you have like a yeast infection, it's in a warm, moist environment. So pinworms, common in U.S. and civilized countries. They're the tiny little worms, not very long at all, that live in the distal colon. What is it normally associated with? If this is common in U.S. and common civilized countries, why would somebody show up with these tiny worms? No, no. It can be with undercooked beef. I'll give you that. Yeah. What else? So to what Alex was just talking about, the idea that you go into a restaurant and tiny print that usually will say, we will not serve any raw meat along the way. That's this right here. So it's not just beef, it's any meat products at all. Undercooked or raw meat products.
How common is salmonella?
In the United States, not all that common. No. Third world countries, different story.
But if you get some undercooked chicken or are you most likely to get it? Or
You at least get the possibility of getting it. That's where your own immune system will go in and try to fight that. Probably going to say. Hookworms found in warm, moist climates. The larva is passing through stools and contracted when barefoot persons walks in contaminated areas. We're talking about third world countries, or we're talking about somebody that is homeless and on the street. And that's the other way it can happen here. So they show up with epigastric pain and anemia. I'm not going to ask you about hookworms. I'm not going to ask you about pinworms. So Dr. Chill.
If we get a homeless person with hookworms, how easily can we get that transmitted?
It is not easily passed on.
All right. Yeah.
So what's this? This kind of goes back to what we were talking about with this right here. Trichinosis, you've heard, okay? Eating raw products, especially pork products. So GI disturbances, usually it's self-limited in terms of the body. However, when the rare occasion when it ends up within the heart, the lung, the brain, then mortality rate is pretty high. Common direct transmission is from person to person through a cough. So again, this is viruses, right? Bacteria not going to be passed this way. This is viruses in terms of how it's going to be passed. So it can be sexual contact, it can be just coming in contact with somebody. The idea that usually has to be direct contact of some kind. Indirect transmission of spreads organisms, such as me walking over there and touching the door handle is a possibility. We're talking about bloodborne diseases transmitted by contact with blood. Typically, the most one that we hear about is this right here. That is the syphilis or HIV. Probably the three ones that you hear about the most. Oh, one other thing about that slide. The idea that we should assume that everybody can put a hurting on you in terms of infectious disease. The idea that everybody's infectious until another one. So to that, part of the gloves thing. And I've been doing this for so long, I will tell you, I can remember the days before gloves. I remember the days before everybody wore gloves. And why did we start wearing gloves? It started in the early 80s. It started why? AIDS, without a doubt. So the world, the craziness that happened in the early 1980s, secondary to AIDS first coming on the scene. Number one, everybody was dying. And number two was we're all going to catch it, we're all going to die. Number three is I don't want to be a first responder because of that. That's the truth. And so the idea that we jumped to the nth degree as far as wearing gloves and things like that, and as we should have, it's turned out. But the idea that we become a little bit smarter about it over time. you know this already, but some infections are transmitted directly on droplets expelled during conductive cough or sneeze. TB is probably the most common portion of this. Tuberculosis and spread by air droplets is the most classic size TB. It isn't the only one. Meningitis is a possibility. You can have airborne meningitis. Mumps, measles, rubella, and chickenpox or varicella. So you've heard about RSV. The other way that this gets spread is by the airborne route. Some infectious diseases are transmitted orally, by eating, or by fecal oral route. That is, by poor hand washing and then turning around and eating. Risk of disease transmission rises if we're talking about open wounds. And again, this should be common logic here. We're talking about open wounds, we're talking about increased secretions, we're talking about whether it's an active cough or an ongoing invasive treatment. Somebody that comes out of transplant type surgery is this community right here that we're talking about. I'm supposed to tell you that you work in poorly ventilated ambulances. Just in case you know that. Did you know that there's supposed to be filters that get changed out in those ambulances every X amount of time? Did you know that?
But they don't.
For this very reason right here. So so check this out. From an OSHA standpoint, remember I told you that OSHA plays a part in this thing in some way? If there's an outbreak of some kind, in other words, if everybody working in AMR were to come down with hepatitis, then number one, CDC would be part of that, the state would be part of that, and OSHA perhaps would be part of that from going back and track whether or not the systems have changed up with the supposed to. So that's part of the way this thing works is a possibility. Based on the current atmosphere, the idea that your employer is responsible for the PPE things that you're supposed to wear. So it's supposed to be glasses, it's supposed to be gloves, it's supposed to be gowns, it's supposed to be masks, it's supposed to be other things you do along the way. They're responsible for that. Again, if they don't, if there's an outbreak, they'll get their hands taken because of that. You should know the difference between virulence and host resistance. Virulent, host resistance. Factors in becoming infected have to have a correct mode of entry that's going to work. The virulence is the organism's strength or ability to overcome the body's defenses. Give me an example of that.
Oh, it's like something like the HIV.
There, right there. The idea that the HIV will break down the immune system in most cases along the way would be a good example of virulence. The number of organisms that are transmitted, that is the amount of dose. And then finally, the host resistance, the host ability to fight off infection. You and I have bacteria floating around in our body. You and I we have the immune side. Remember when we talked about that? We talked about the 5 different kinds of immune classes. We talked about the white blood cells, the plant compartment. We talked about the lymphocytes and then like stuff. That's what this is all about right here. We should also know about latent period, incubated period, and incubation period. So latent period, once infected with infectious agent, the host cannot transmit agent to someone else. What is that?
You haven't built up enough that virus or microorganism in your body to be able to pass them on.
Well, that's part of it. You're kind of there. So what happens? Why is there like a lifetime when you had syphilis? Why is there a lifetime before you can actually spread it to somebody else? And there is this long period.
Organism needs to grow.
Yeah. So the idea in terms of mutation, the idea in terms of growing, the idea in terms of that you will be communicable for only a period of time. Past that, you can set with that. What did I talk about a couple of minutes ago that you and I are in a late period of? MRSA. You and I are in a lane period about worse. You and I have been exposed to it. You and I have been in contact with it. But the idea in terms of after passing on to somebody else, we're in a lane period. And the hope is that none of us would end up being able to pass that on to ourselves further or somebody else. When we talk about a communicable period, we're talking about the host may exhibit signs of clinical disease and transmit infectious agent to another host. What's another way of looking at this? How long are you contagious for? So you can have the flu for X amount of time, and so for the flu is a good example. The communicable period is very, very short. We're talking about days. So truly, for you being able to pass it on to somebody else around you, that is only a matter of days. Once you've done that communicable period, you move on to something else, then you're not going to be able to pass it on. This incubation period is time between exposure and presentation. So that these two go hand in hand. Communicable period and incubation period. Questions about this? You know this. All right, like we talked about in the past with the 5 different classes of immune side. Viruses and bacteria have surface proteins or antigens that stimulate body to produce antibodies. So what's an example of how we can, when I say we, I'm talking about the medical community, what's a way that we can have an effect on this right here? Vaccinations, right? So the idea in terms of an active vaccination is part of this right here, developing the antigens that fight our antibodies that will fight off the antigens. When we talk about a window phase, we're talking about time between exposure to disease and seroconversion. Seroconversion, when you had your hepatitis, how many of you have had hepatitis B shots? You're serious, okay? So all of you, or most of you at least, right? So the idea in terms of the seroconversion is assuming that you have enough antibodies that's going to cover whatever the exposure is. So in other words, you have some sort of a incident to where you get stuck by a needle. And so the idea that you came in exposure, you came in contact with this exposure versus the seroconversion, how long did it take to show up that you had enough titer to fight off whatever this might be along the way? It's a good example of a window phase. The disease period is duration from onset of signs and symptoms until resolution. So the average onset of the flu is somewhere around 7 to 10 days. And so the idea from the very first that you notice it until it went away, on average, is called the disease period. So this should be review for you. The immune system, the 5 different types, fights disease by protecting the body from foreign invaders. The inflammatory response, or the leukocytes, is what we've been talking about, or the white blood cells, are the big boys in terms of fighting, in terms of being for the immune system. So with that being said, then who's in trouble because of this? Yeah, leukemia, probably the most classic one, or cancer patients in general, would be the big thing about this. Same thing in terms of neutrophils and macrophages. That's another portion to the white blood cell. Where have you heard about phagocytosis before? So remember when we're talking about anaphylaxis, we're talking about the immune system, we're talking about phagocytosis to where it will come in like a Pac-Man type of thing, will chew up the bacteria along the way. That's what they're talking about right here. All right, humoral immunity, immune system properties of memory and specificity. Uses antibodies from mature B lymphocyte in the lymph nodes and bone marrow for future exposure. What's this say to you? What's that saying to you? Correct. And so they set and wait for the next exposure to whatever that might be. And so it's kind of like an allergic reaction, if you will, only different in terms of what we're talking about this time is bacteria and viruses that's going to be part of this, okay? but they sit as part of your immune system to fight off whatever's coming in the future.
So would that be from like a vaccination then, humoral immunity?
So no, this is more. Well, it could be in the sense that you've had it and it just sits there, but typically this is more of a normal reaction for people. So you sit, you grow, and everything else like that, and this is part of that in terms of where you had before. So unfortunately, it's that time. They put a hurrying on you. What we talked about in the past was about IgE. What we're going to talk about today is the rest of it. So remember I told you back then you didn't know about the other four. Today you need to know about the other four. Okay? So IgG remembers an antigen and recognizes repeated invasions. It crosses the placental barrier. Why is that good news? So protects the fetus, right? And so there's an immune system that already gets passed off based on immune. IgM formed early on in immune responses. IgA, milk, immunoglobulin, and has created secretions of milk. So we talk about a mom breastfeeding. We're talking about this right here. Respiratory saliva and tears. IgE present on surface of the B lymphocytes act as an antigen receptor. Right? So if I'm saying you're sitting there going, what in the world did you see talking about? Okay? Here's the way they would remember it. We talk about IgM, we're talking about very early on. We're talking about IgG, we're talking about in utero. We're talking about IgA, it can be passed on in terms of milk and respiratory saliva. And then finally IgD. You've already, I won't ask you about IgE because we've already had that in the past. So something that's called a complement system provides alternative pathway to react more quickly to foreign bodies. So you don't need to know the fact that there's all these 20 proteins that works with an anti-inflammatory formation, but the idea that there's a secondary system outside of just white blood cells that play a part in this. And so it's called a complement system. The lymph system we talked about with anaphylaxis. We talked about allergic reaction moving away. Remember, the lymph system is kind of like a garbage dump, if you will. It's a dumpster to where bacteria gets dumped into. So the phagocytosis that goes on would dump into the lymphatic system that's going to then be excreted from your body. Remember, we talked about, you talked about when you did the gastro, you talked about spleen, and the idea that these B and T lymphocytes play a part in terms of helping with antibodies. All right, everybody stand up. I can feel the sap that's draining out of you. Stand up. All right, so you do need to know about the 4 different types of immune side, the classes and everything else like that. Go back and figure a way for you to get there in terms of that. It's never ever easy, but go back and take a look at that. Complement system is what?
Protein.
It is protein, but what else about it? It's what? So it's a secondary system, secondary immune system that's going to help protect along the way, okay? It's faster than a typical type development along the way, okay? Complement system is nothing that you really need to know. Question so far? Is this like totally Greek to you? No. A little bit? Okay? So what are you going to need to do with this? You go back and take a look. Serious look at this along the way. The good news is you're going to have about a week and a half today to figure this out and determine that step for you, right? Go back and take a look at this, right? Big deal. All right, so while you're on your feet, tell me the difference between passive immunity and active immunity. This plays into you, folks. Passive immunity, active immunity.
So, what was it, the IgE that you get from breast milk and stuff like that?
IgE is about allergic reactions, right?
IgM?
IgA.
Think about the grocery store, IgA. I'm going to the grocery store to get some milk. That's the same thing with this, okay? Right.
So, would that be with passive immunity?
Say again?
Would that go along with passive
That would be
immunity?
exactly passive immunity, right? receive antibodies from maternal circulation. We already talked about that, right? So let me take it back one more time, so we kind of got this in together. That is that, IgG, okay? Would be the best example of passive along the way, okay? All right, you want to sit down, go sit up, back down again. Versus active immunity, which is a form of humoral immunity. You need to go back and take a look at humoral immunity. What that is, humoral immunity develops specific antibodies in response to exposure or inoculation by a killed or modified form of infectious agent. This is what? This is vaccines, right? So whatever your stance on in life, whether or not you love vaccines, hate vaccines, conspiracy theory, and everything else about vaccines along the way, the idea in terms of where you stand with it, nevertheless, this is what it does. Right?
Very,
Sure.
like having chickenpox when you're a kid and being immune, that's active.
Yes. Yep. When we talk about serotype, we're talking about converting into something, okay? So serotype, somebody gives you a shot along the way, hepatitis B would be a good example of that. Serotype of whether or not you're immune secondary to that hepatitis B. But just because you got hepatitis B series does not necessarily mean that you converted in terms of serotype. That's why theoretically what you need to be doing about every 3 to 5 years is going back and getting a titer and make sure that you truly are immune to that. And that's serotype, for example. All right, so let me bring it back into a little reality for you. You and I must protect ourselves from infectious agents. Got that, Jerry? All right. So 4 phases of infection control and pre-hospital care is preparation. What do you think preparation is? Yep, so that. What else? Washing hands. Good. What else? You are dispatched for a lady who's giving imminent birth. So gown and gloves and mask and everything else like that, right? Would be a good example of pre. That is with your employer disease supply. What about response? When you're in the middle of it all. What about patient contact? What about recovery? We're talking about that. All right. So this goes back to what Matt was saying. The idea in terms of we can either be carriers in terms of passing it on to somebody else, or we can break the cycle. So up here, remember we talked about virulence versus dosage. Virulence is the strength of whatever the organism is that we're fighting. So that's the initial thing. So it goes down here, and remember we talked about the fact that it can be spread directly or indirectly, and that is by airborne, bloodborne, foodborne, would be 3 different ways. This you need to know right here in terms of routes. Okay? So it can be direct or indirect in terms of that means, and then the direct routes are these 3 different things right here. And then finally, up here, the host resistance and protective measures. So by you washing your hands here, you're going to prevent the spread of things here. By you not getting splashed in the eyes because you're wearing glasses, is the fact that you're going to prevent this right here. Okay, so the things that you do along the way in terms of infectious disease, you can break this entire cycle. This continues to go and go and go and get worse over a period of time. So part of that preparation I talked about is having PPE available. But the other thing about it is that employers are required to have procedures or protocols in terms of infectious disease. So whether or not you know it, your employer should have something in place in terms of the do's and don'ts of what you need to do. Whatever that infectious disease plan for your organization is part of this right here. The response is obtaining information from dispatch, knowing what you're walking into. And again, nothing about the dispatchers, but the idea that you always know what you're walking into. You know every single patient that has meningitis, right? But the idea in terms of you may know very little about it. So the idea that when we talk about PPE, we're talking about that it's very little type thing that moves second by second for the possibility. as much as possible, the one thing that we've gotten better at is going from reusable type stuff to disposable type stuff. Back in the good old days, it wasn't like that. The idea that you would end up using the same thing if you clean it over and over again, and especially the laryngoscope and blades and the like. So that was exciting. Same thing in terms of that we've gotten away from using a whole lot of needles. The idea that we've gone to a needleless port type thing for pushing IVs and the likes of. Yeah, please tell me about this right here, okay? The idea that we're coming in contact with this is a problem. Same thing with this right here. Talk about this. So check this out. Tell me about gals who are pregnant working in the healthcare field. What's your current thinking about that? Secondary infectious disease. Okay. So what? They can't go on like light duty, or they can't go on like part-time?
That's something you work for.
AMR's theory or stance is that it's not their fault you're pregnant, therefore they're not going to put you on light duty.
The reason I asked the question, folks, is a couple of things. It's a hot button type question in terms of start-time infectious disease. Okay. Knowing that, the idea that this is this condition.
I think AMR said you can start chemotherapy or something like that. Like, ridiculous, where you're like, right at.
Yep, that's true. So recovery is as you expect, getting it ready for the next call, and the idea that we probably do a lousy job of this on a day-by-day type basis, but as much as possible, getting it clean. So if you sustain a wound or exposed to a body fluids, what's your first thing? So you want to clean it up, obviously, right? And then what? When you say punt? And then what? So you get a needle stick. Let's say you get a needle stick. So you can wash your hands afterwards. Then what? So supervisor, if we're talking about AMR, okay. So we end up going to the ED. Your supervisor, 9 times out of 10, will say, "I'll meet you in the ED," right? What happens there? What's the cocktail about?
It really depends on.
Depends on what you may have been exposed to, they don't know what you don't already know. A lot of times, it's also a matter of whether or not they get it.
Okay, so there's a whole host of things we're talking about. So let's kind of back on the bus just a wee bit. I'm getting ahead of myself in terms of this, but I'll come back around to it. So Ryan White, what's Ryan White about?
Blood transfusion that had the virus and they just didn't know it. They didn't check for it back then.
Okay, so once they did find out, they couldn't go back and check because there's no legislation for it to happen, right? So what's Ryan White? How does Ryan White affect you now?
If we're exposed, we can go back and find out if that patient has.
How do you do that, Will? Yeah, you're perfectly there, but how do you do that? Even before that.
Tell your supervisor they're supposed to talk to the hospital.
Right, so the doc is the one in terms of going to that patient, counseling with that patient, but the doc is going to draw your blood based on this. What happens if that patient refuses? They can be forced to do that, right? So that's the good news about Ryan White. So let me scare the jeepers out of you. Ryan White was one of those things you always assume was going to be there in terms of legislation. It doesn't work that way. Ryan White is good for 10-year periods of time. Ryan White legislation came out in about 2014, 2015 or so. Ryan White legislation had expired. So theoretically, if we went back to the battle days that you could not get your blood drawn, you could not order somebody to have blood drawn away. So the good news is that legislation came back through, was reenacted soon after that. It's good for another 10 years. But Ryan White, that's what it's all about. That's why you should know about it. Okay? right, so let's go one step further. Assuming that they go and draw the person's blood, patient's blood, exposed to them. Then what? So they kind of test in terms of it's determined that he's got HIV, it's determined that he's got hepatitis, it's determined that he's got something on the way. So what does that mean to you?
I think that's possible. We start regimen to figure out if you're.
Right, so at the same time, you're having your blood drawn, right? What do they do with that? They're testing for whatever it is, right? So then check this out. Is there any magical button, any magical shot you're going to get for HIV? You're going to get antivirals along the way, okay? But there's nothing dramatic in terms of, but it takes this thing away. How about hepatitis B? What are they going to do? Assuming that you've all had Hep B series, what are they going to do? Well, yeah, they will do something. They're going to check the titer, right? They're going to check the titer whether or not you're serial converted, like we talked about earlier, right? So the idea in terms of that, if not, they're going to give you a follow-up shot as far as hepatitis B. Right? Again, it's not going to take the hepatitis and take it all away or anything else like that, but it's going to make a difference in terms of what's going on. Then what? Yeah, depending on what it is, they're going to start getting antivirals, perhaps bacteria or perhaps antibiotics along the way. That one. That you follow. You're followed in public health, you're followed by somebody at periods of time. So 2 weeks, a month, 3 months, 6 months down the line in terms of they want to check blood every single time along the way in terms of what happens along the way. Have any of you been unfortunate in terms of exposures? Yeah.
I've had a Medicaid drug that got bothered, Yeah.
They come out of anything in terms of the patient?
No, they actually just, the doctor thought it was just a drop and they were worried about being exposed by that.
Okay. Yeah.
I got spit in the eye by a drunk teenage girl.
Okay. Well, let's do on that.
Where are my glasses?
Right.
So it wasn't actually me, it was my accident, but apparently she got exposed to meningitis. And the hospital was actually fairly good. They called the soup, and then the soup called her within like 2 hours.
Yeah.
And they just started her out, and they just gave her a giant shot of antibiotics.
Yeah. So to that, we'll talk about meningitis specifically for that, but that's the scary one in terms of when you're going on. But here's the thing, folks. Yeah.
With meningitis, I didn't have personal health patient about a year and a half ago that was diagnosed with meningitis. And it wasn't my patient, but I helped to restrain them with the they said they didn't go to sleep. And the crew that had a patient got treated prophylactically, and then me and my partner.
Yeah, so that's part of the follow-up in terms of any exposure that goes on. They talk about prophylactically, just start just because maybe. So it's kind of a big deal. The idea of this whole system is based on operating procedures along the way. And so to that, OSHA would come in and they would fine you dramatically by not having a procedure in place for this. Okay? So obviously hand washing, I'm supposed to tell you that hand washing is the most effective disease process, or the barrier to passing on diseases. The other part of recovery is disposing of biohazardous waste in a appropriate manner. So you should know the difference between a low-level, intermediate, and high-level disinfection and sterilization. Go back. So low-level destroys most bacteria, some viruses, and fungi. That is, what do you do with your stethoscopes when you want to clean them? Yeah, because that always works so well in terms of how well that goes, right? So the idea of stethoscopes around the neck is a bad move, but in terms of cleaning it, how do you clean it? So kind of like a bleach wipe or maybe alcohol wipe or something like that, right? That would be considered to be a low-level disinfection in terms of what we're doing. Intermediate level disinfection destroys mycobacterium, tuberculosis, and most viruses and fungi. And what are we talking about here?
Those purple chocolate, those purple top wipes destroy AIDS and hepatitis.
So check this out. Yeah, and you're right, but check this out. tube that you're getting, everything else like that, it varies from tube to tube in terms of what it will actually kill.
I was bored when I read the actual, so
Right.
ones that we carry actually, they say the
Right.
utilities and
Right.
hepatitis,
Perfect.
yeah.
Perfect.
So those disinfectant wipes, why are they used on stuff that's going to be touching skin when they say it's not supposed to be used on skin or it's carcinogenic?
You don't bathe your skin. Yeah, and once it's dry, it's fine. It's when it's wet, you don't touch it. So,
Yeah.
don't wash your face with a melon.
I don't want to take a bath though.
A real
Quick
red
bath is.
rash.
That's what they tell us.
So most of the stuff, check this out, most of the stuff that you're carrying in terms of cleaning, is gonna be along those purple tubes or something like that. It's a general disinfectant in terms of what's gonna kill it, okay? We talk about high level, we're talking about, destroys all forms of microorganisms except certain bacterial spores. It's only by one means it's gonna happen, that's this right here. So sterilization and high level disinfection is the means together, okay?
So when we prep for IVs, why do we use low level alcohol instead of like an iodine?
Because, well, now there's a great question. The idea that theoretically what we're supposed to do, and anytime, remember we talked about it like way back in the day, the idea that that theoretically what you want to do is take an alcohol and wipe the skin, take a betadine, come behind it, take another alcohol on top of that. That's the whole reason that procedure is getting pushed. But for us being quick at what we're doing, usually it's just alcohol. So I don't have an answer as to why we do that. So what would be an example of what you might end up doing in terms of high level disinfection? Yeah, but what items might we end up doing in terms of autoclaving? What are we carrying these days? So not even the blades anymore. Most of those blades out there are disposable. So it used to be handles. Laryngoscope handles is what you use to set through an autoclave. Okay, but
Sterilization, correct?
yes, yes. But we've got to the point where just about everything is disposable along the way that we're not using much of this anymore. All right, so you should know this, okay? And based on what I told you already, you should understand this in terms of Ryan White Act. I'm dating myself. I thought it was closer than this right here, 2009. So this just talks about the fact that employers are required to have a plan in place for what happens as far as exposures, okay? And whether or not you know it, your employer should have something in place for you. That's a good place to do a stretch. Come on back in about 5 minutes. Let's keep moving.
So there you go. That's all right. Otherwise it's fine.